I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
It will be a struggle to contain the spread quickly. I think it will take many, many months for us to be able to get this outbreak under control. I do wish that the WHO and others in the international community had been more forceful sooner in raising the alarm, but it is better late than never. And so hopefully this will give us some additional momentum in trying to increase our response.
Definitely will be a major global challenge to contain monkeypox, given what we now can see. Now, there are more than 16,000 cases have been diagnosed. We see it in many countries around the world. I think what is still a reason for some hope and a plan to try to contain this disease is that, as for the most part, been spreading within a particular demographic of people who are men who have sex with men. That's the great preponderance of cases. And because of that, efforts to try to care for that group of people and provide them education and resources and vaccine wherever possible and therapy wherever possible, the efforts to try to bring this under control can really focus on that particular demographic of people. I think the concern is that if this then continues to spread into other networks of people or other demographics, it gets increasingly difficult to contain this disease. So while we now know where it's being spread and have the chance to intervene, I think this is the time when all available resources should be going towards that goal.
These serious emerging infectious disease threats are not going away. There are many factors that I think combine to increase the likelihood that we'll see more of these going forward. And so we really need to improve our efforts overall to recognize serious emerging infections early and to counteract them quickly before they become international incidents and pandemics.
Everyone around the world is exhausted by the experience of COVID. And now I think many people are kind of very unhappy and concerned to see a new outbreak be declared a public health emergency of international concern. In this case, there is a vaccine that is effective and a therapy that can treat this disease. And there are tests and an infrastructure that we can use to test for this disease. So we're not without tools or a strategy, but it is just going to require more effort around the world to move quickly when these new outbreaks emerge. So I think as we go forward, hopefully, and get control of monkeypox, and as we go forward with the COVID response, and we hope for better times ahead there, we still can't let the energy and the resources and the science and infrastructure that's been built around these responses in any way diminish, so that when we have the next infectious disease crisis, we need that to be ready for the next time.